I signed the ordinance to devote $2.7 million of additional resources to external agency funds so our nonprofit partners can continue serving people and families in need. So when you think about the work that our great community ministry's done, I think we've got the best community ministries in the country. Dare to Care, another best practice in terms of a food bank. These are the type of organizations and others that will be receiving the $2.7 million to distribute to those who are most in need in our community. So good job to the council there. I had a call with the council today from noon to 1 p.m. Just to share what's going on in the community and ask them, what do you think we should stop doing? What do you think we should start doing? What should we keep doing? And what kind of issues are we thinking about in terms of short, medium, and long-term planning? So I talked about the aid packages that the federal government is working on and what that could mean for our city. A lot of concern amongst our everyday citizens, and this also came up with the council about complaints where people are gathering together, not practicing social distancing. So that could be in our businesses, bus stop or parks or whatever. So we talked about our 311 line, and that is the line that you can call that's the number 311 that you can call if you see groups of people congregating in an unsafe, non-socially distant way, right? Why is that? Virus passes when people are close together, breathing, coughing, sneezing, shaking hands, touching surfaces. So the more we keep that from happening, the healthier we are going to be as a community. So you can call 311 if you see anybody with a problem with not being socially distant. Sorry, we got to do that. I can say the council is in full support of that. We all have the same goal. We want everybody to be healthy and safe. Okay, one way that we do that is to make sure that we're keeping track of critical data that we're going to need to make decisions on. And we're tracking that data through our incident management team. So here's what we're at today with some of our data. As of this morning, there are 104 positive test results statewide, 28 cases in Jefferson County, and including one fatality, sorry to say. We know the numbers are going to increase with the spread of the virus and increase in testing capacity, so we expect that. About 1,900 Kentuckians have been tested so far. As we know, most everybody's going to recover. 80% of these cases are mild, 14% are severe, and 5% are critical. Remember, for folks that say this doesn't affect them, they're going to be fine. We know that you may not get in contact with the virus, but if you do, you may not have severe symptoms, but you are a carrier, and that means then when you're hugging on Granny, you're giving Granny the virus. And Granny's older, and she's in a high risk category, so she can be a person that can have severe consequences up to dying because of your negligence if you have not practiced social distancing. Okay. So that's what this is all about, is taking precautions to minimize the number of folks that get the virus, especially the older folks and those with chronic conditions, because what we don't want to have happen is what we see in other communities is people go into the hospital and the hospitals are overwhelmed. They cannot handle all of the need. That means they have to start rationing who gets care. We do not want your granny to be one of those people, okay? So you've got an important role to play in this. So I'm talking to all Louisville, but I'm talking to young Louisvillians in particular. I'm talking to the Louisvillians that we heard were out in the parks yesterday playing pickup basketball games. You can spread the virus that way. Talking about people playing ultimate frisbee, you can pass on the virus that way. So right now, New York City and New York State are the hotspot of the COVID crisis in the United States right now. You're seeing their hospitals having a real challenge. New York State has about 17,000 cases. That's more than most countries. And New York City Mayor Bill de Blasio says New York hospitals are only days away from running out of critical life-saving supplies. If that happens, people whose lives could have been saved because of people being more responsible with social distancing, they will be lost. And that's what we're working 24/7 to avoid. And that's why we keep talking and emphasizing about social distancing. Folks, for whatever reason, some people are still not getting it in the community. So, for our media partners, everybody listening in on social media, please keep emphasizing that, okay? Putting 6 feet, think about that as a life saving distance between you and other people is critical to save others that you love. You might feel fine, and you might say you don't need to do this, but this virus can be in your system for 2 weeks before you show symptoms. And you can infect a lot of other people during that time. Obviously, that's why I'm coming to you from inside my house for the last week because I am on self quarantine because I have been exposed and I don't want to take the chance of infecting my friends, my parents, my colleagues at work, and people that I run into public. So, social distancing saves lives. That is the bottom line. Now, let's take a look at this graphic to emphasize that. With no social distancing, one infected person can infect over 400 other people in a month. Think about that. With strict social distancing, that number declines to about 3 in a month. So think about how that saves lives. One person not knowing what they're doing or being irresponsible can infect over 400 other people in a month. And think about those 400 other people infecting other people. And it goes on and on. That's why we're seeing this number grow so rapidly around the world. So, social distancing is how you save lives, neighbors and friends, parents and granny. Okay, so it's not just about you or any one of us. Don't be selfish, don't be arrogant. This is about saving our community and the people you love. Okay. So you just got to be responsible. Stay home if you have to do it. Be socially responsible. Right. Let's take a break from COVID-19 for a minute and talk about something else. But it does require the same kind of civic responsibility, and that is the 2020 census. 2020 census is underway. Uh, it's very important that everybody in our city responds. The census affects how much federal money that we receive, and it's a factor in business decisions and also helps determine how much money goes into our schools, our school lunch program, teacher support, resources for our children. So, all the federal money that comes into the cities of America all are a portion of what our census count is compared to the rest of the country. So, we've got to be counted to get our funds. 3 options to respond. All of them are easy. First, online at my 2020census.gov. Uh, Before my great wife Alex was in self isolation with the virus, she and I completed the census online. It's easy. It took no more than 10 minutes at the max. So it's an easy thing to do. And a lot of us got time in our homes right now. So go ahead and complete your census. You can also complete it by mailing it back in, or you can phone 844-330-2020. 844-330-2020. And the census is available in multiple languages. So when we get through this crisis, we're going to need every federal dollar we can to help us as our city, and so the census can help it. So please fill out your census forms, stand up and be counted for Louisville. The census has already agreed to extend the data collection deadline through August because of the virus, but go ahead and knock it out. So you're one less thing for you to do. And this is a super important initiative. So today I'm joining mayors across America by signing a letter from the United States Conference of Mayors requesting that the Census Bureau extend the deadline out even through the end of September and revisit it as need be. All right. All right. I talked about we got 2 challenges happening, right? We got a health emergency, we got a financial emergency. So Dr. Sarah Moyer and our Public Health and Wellness Department have been leading our effort. They have incredible powers to both help us through this and then issue guidelines that we have to follow to keep ourselves healthy. So let's check in with Dr. Moyer. She's going to talk about COVID-19 testing. And there seems to be some misconceptions about what the test is all about and how it helps. So, Dr. Moyer, if you could illuminate us on this, we'd appreciate that, and any other news that you want to share. Sarah Moore.
Thanks, Mayor. So, as you mentioned, every day we're seeing an increase in cases both locally and throughout the state. And this just means there's evidence of community spread happening. It's definitely present in our community. So the state and the city of Louisville have taken really significant measures to promote social distancing because it's the best tool that we have to combat COVID-19. And it's really critical that we abide by these measures. We must all protect ourselves and the most vulnerable members of our community. So we all need to be staying home. And I really know this is difficult and inconvenient, but we continue to see data coming in from other countries and other cities and states within the U.S. That confirm that what we're doing is absolutely necessary to protect your health and the health of your neighbors, friends, and family. The more we as community members do our part to comply with these restrictions, the less the spread of COVID-19 will occur. So we're getting a lot of questions about testing. Everyone wants to be tested and feels it's really urgent. And I know when you're worried, you want to do something, and staying home doesn't really feel like you're doing something, but staying home is the best thing you can do if you think you have COVID-19. So there's a couple important things we need to know. First is that testing's not perfect. Sometimes we think people are positive and the test is negative. So first and foremost, just please listen to what your doctor's telling you. They know the case definition. They don't have to rely on the test. And they know COVID-19 is spreading throughout the community. So test or not, if they think you have it and they tell you to stay home, please stay home, isolate yourself from other family members until your symptoms are gone for 3 days or it's been 7 days since your symptoms started. And we keep saying that 80% of cases have a mild illness. And by mild illness, that means that you're going to feel bad for 7 to 10 days, kind of like the flu. But 80% of people, you're able to stay home and recover and do not need hospital care. And that's what we mean by mild. So whether or not you get the test, there is no cure yet. We know some medications are being tested and are showing some promise, but there is no antiviral or medication that will shorten the symptoms of COVID-19. So unless you have severe illness, you're going to be told to do the same thing, whether or not the test comes back positive or negative, and that's to stay home, away from friends and family, take some Tylenol to manage your fever, drink plenty of fluids, rest, and most importantly, again, stay home, stay away from others. So if you're having symptoms, stay home, make sure you're cleaning your house, and contact your healthcare provider if you need guidance on whether or not to return to usual activities. Each week, we're able to test more and more people than the week before, and researchers are working really hard to develop new tests as well, too, tests that are going to be faster, tests that the hospitals can do it themselves and not have to send out. But right now, testing is available for those who need it. So who needs it? One, those that are sick enough to be in the hospital. We need to know who has COVID-19 while they're in the hospital in order to conserve PPE or personal protective equipment and to protect the healthcare workers caring for those patients. We also need to be able to test our healthcare providers who have daily and prolonged contact with those in our high-risk groups. So those are the people over 60 and people with chronic medical conditions. We need to know if our healthcare workers are positive so they can stay home and not infect the other high-risk patients that they are caring for in the hospitals. And then we also are testing people who have symptoms who are over 60 or have chronic medical conditions. And we save tests for these people because their illness can start mild but turn serious in a matter of days. And then when we know their status ahead of time, our first responders and healthcare workers are able to take the necessary precautions to protect themselves when they're getting transported to the hospital and then when they're in the hospital as well, too. So just a summary, if you're experiencing symptoms, the best action is to self-isolate at home, call your doctor. If your doctor thinks you need to be tested, they will get you tested, but they may tell you to stay home. In that case, please stay home. We've had reports of people going out looking for tests, and as the mayor showed in that great graphic earlier, on a normal day, one person can infect 400 people in a month, just the way the disease grows. So if you purposely are going out looking for a test, you're going to be infecting even more than that. But of course, if you're having serious illness and need to seek care, you should do that. But just recommend you call ahead first so our EMS personnel and our healthcare workers know that you're coming and can take the necessary precautions to protect themselves. And so just emphasizing again that a test is not necessary for everyone, and the test isn't what's important. Staying home and staying away from others is the best, strongest, most effective tool that we have for saving lives. And of course, good hygiene practices as well. Please make sure you guys are all washing your hands for 20 seconds at least, especially before eating, touching your eye. I mean, we've been hearing about other cases people are worried about. You are fine if you are staying home and you're just washing your hands before you eat. That's the best thing you can do to protect yourself. And so by not really getting out there trying to get the test, you're making a commitment to protect our healthcare workers, our emergency service providers, and other more vulnerable or adults that have to be out in the community still. It's also preserving a hospital bed for when your child or your mother, either you need it, and it's giving our researchers more time to test potential medications. It's giving our factories more time to ramp up production of PPE and lab tests. And a little time makes a huge difference in number of lives saved. I mean, that's why we're trying to flatten that curve, as the mayor keeps mentioning, and the longer we can spread out the transmission of the virus, the better off our entire community will be. So with that, if you see people, I also want to emphasize again what the mayor is saying, if you're seeing people socializing still, please call 311 to report it. We want to make sure everyone is following the orders in place by the state and locally. So please call 311 if you see people not following those. And then most importantly, please stay home. Even if you are well, practicing those great social distancing messages that Dr. Koloya emphasized yesterday. Every time you leave your house, you risk getting COVID-19, or if you're an asymptomatic carrier, you risk spreading it to other people. So please work from home, only go out into public places to purchase necessities such as food and medicine. It's okay to go outside, to go for a walk and for mental health breaks and enjoy the beautiful outside, but please practice social distancing when you do. And we can work together by staying physically apart. It's a sign of unity, so on our social media posts, keep posting the governor's hashtag healthy at home and Together Kentucky, because working together we will get through this, but we need everyone working together. So please practice social distancing and don't worry if you can't get a test. Thanks.
Okay, thanks, Dr. Moore. Appreciate that. All right. We talked about this being a health emergency and a financial emergency, so I want to talk a little bit about finances right now and specifically jobs. So we know a lot of people are out of work as a result of COVID-19. Our hospitality industry all over the country is really getting hammered right now. So lots of folks out of work and feel very bad about that. Unemployment filing deadlines have been relaxed. Before you had to wait 7 days. Now there is no wait period at all on that. We're working to support our small businesses so that they also can understand this period of uncertainty and start hiring and rehiring when it's over. So in the meantime, for people who are looking for work, Kentuckiana Works and GLI have partnered to create a new online jobs board listing for current job opportunities in the area. So you can see the job listings at www.kentuckianaworks.org/jobs. kentuckianaworks.org/jobs. Okay, and that's being updated daily. So companies that are hiring can also submit their job postings there as well. All right. So there's some opportunity out there in this downturn. Okay, finally, I want to thank everybody who stood on their front porch last night in their front yard and rang bells or banged on pots and pans for our 7 o'clock stand up in solidarity. I can tell you that I beat a big skillet mercilessly, and it felt good to scare away the virus. My Greek mother-in-law lives with us, and she said that's what they do in Greece. They want to scare it away. So we were scaring away the virus as we stood in solidarity with everybody. So I encourage everybody at 7 o'clock every night, get out there and beat on pot or pan or blow a whistle or ring a bell and just say, yeah, we're still here with each other. Okay, so have some fun with that at 7 o'clock. every night. Lift Up Lou, we launched that for city morale building and keeping everybody connected, maintaining our mental health in the community. And so Lift Up Lou, is a collaborative effort designed to lift our spirits and maintain our mental health and our social connection with each other while this is going on, while we practice social distancing. So as I mentioned, we're going to see some incredible things out of that with our great musicians. Teddy Abrams is one of our leaders on this effort. Ali Center, the Louisville Zoo, libraries, some of the head chefs in our city, which are some of the best chefs in the country, by the way, and then just other artists and cultural institutions. So get more involved. Go to liftuplou.com or at liftuplou and participate in that. As I also mentioned, put an American flag out. I mean, the whole world is being affected on this, but we're Americans. And so if you have a flag, put it out. If you don't have one, maybe print it from a printer or just make one. Kids out there, have that as part of your project tomorrow. Make an American flag, put it in your front window. It's just a way for us when you're walking out about just to say, we're in this together. We're going to get through it. Okay. So get your flags out there and show your pride for our country. Okay, now, so after you bang your pots for a short minute here, or short seconds tonight at 7 o'clock, Lift Up Lou at 7 p.m. is starting a session on mindful parenting. How about that? I imagine there are a lot of parents out there that are saying, how am I responding to this new order of my kids being home all the time? So raising kids under any circumstances is challenging at times. I think we would all agree on that. And it could be even more challenging right now. So tune in tonight, liftuplou.com, to learn how to be a more mindful parent. Nobody can go wrong with a session like that. So thanks to our Lift Up Lou team. You can join all Lift Up Lou sessions from our Facebook and Twitter page, which is at Lift Up Lou, and just get connected. Okay, folks. So closing this out, obviously, we're in a real serious situation right here, but we're going to get through it together. As I've mentioned, your Metro government is working 24/7 to make we're as prepared as possible for this with all of our community partners. So we'll now go to some of our media questions over here. Let's see. Is there data to show where the most cases are occurring in Jefferson County and are cases concentrated in one area? That data is being gathered with our incident management team. So I got a preview of that yesterday. The cases are spread out. For the most part, there might be a neighborhood or two that has a little different concentration, but the folks that are really keeping that data in shape the most is public health and wellness. So Dr. Moore, you want to add to that, please?
Yeah, that was a great answer. The only thing to add is that we don't have enough cases to make it statistically significant yet, the numbers of where they are, but we do have evidence that it's pretty much widespread across our community, which is why all the drastic measures that the governor and the mayor have taken about social distancing.
Thank you so much. I would call them responsible measures as well, not just drastic.
Responsible. The most we've seen in our lifetime, though, but responsible in order to prevent the spread.
That's right. Okay. What if employees are afraid of reporting their company because they told them they will be fired if they don't go to work? Well, first off, nobody's going to know who's reported who. But if your place of employment is threatening you that way, we need to know about that. So the process is, when the 311 call comes in, it goes to our incident management team, and then we will dispatch the appropriate party to check it out. So that would be our codes and regulations, alcohol and beverage control, if it's a bar, health department, or LMPD. Okay, so we want to know because we want you to be safe. If there's unsafe social distancing going on in the community, that's how the spread really gets out of control. So we need you to help us out on that. Okay. We don't have a lot of questions today, so I'll wind this up. And just again, thank everybody for tuning in and being responsible citizens. We continue to kind of narrow down on what people are doing, and we will continue to do so. If we don't see people complying the way that they need to comply, and it's not because I'm saying it, I'm some kind of person that thinks he knows everything. It's because the science is telling us what to do, and the data is telling us what to do. And if we don't do it, we're going to have a big spike. It's going to end up with a lot of people really getting hurt with their health, up to and including dying. We're not going to have that here. We're going to try to minimize that as much as we can. Okay? So that's what's guiding all this activity. So please spread the word on everybody helping us. I just say God bless everybody. Let's look over our great city here as we all work together and get through this together. Okay. Talk to y'all tomorrow. Thank you.